Hi, I'm Siege from the Puma podcast team. If you like listening to this show and others created by our team, you can help us keep making them through our Puma Patak tip jar. Our goal is to get 100 of you, our friends, to make a contribution and show your support for the journalism and storytelling that we do. We're happy to keep making shows that you can listen to for free, but making them isn't free. So we appreciate any support you send our way. All you need to do is to go to pumapodcast.com where you'll find a link to the Puma Patak tip jar.
Hi, I'm Bella Perez Rubio, Puma Podcast, and you're listening to Teka Teka News. Balitang thinking, hindi breaking. In this episode,
WHO is very concerned over the evolving situation in China, with increasing reports of severe disease. In order to make a comprehensive risk assessment of the situation on the ground, WHO needs more detailed information on disease severity, hospital admissions, and requirements for ICU support.
that was World Health Organization Director General Tedros Ghebreyesus raising the alarm on a COVID surge in China and appealing for more transparency from officials. And no, that soundbite wasn't from 2020. It was from 2 weeks ago. Call it bad deja vu, but nearly 3 years since COVID 19 was declared a pandemic, the virus is wreaking havoc in China once again, and countries are tightening borders against Chinese travelers. Don't worry, it's not because of some new virus strain. It's because in November, Beijing abruptly abandoned its COVID zero policy of hard lockdowns and mass testing. They even relaxed rules for travel in and out of the country. But the key word is abruptly, because it left the healthcare system little time to prepare. In short, they opened up the economy while the population had little immunity, both natural and from vaccines.
The population that is being affected in China are mostly the elderly population. Their boosted population is really very low compared to the Philippines.
That's Dr. Ronjean Solante, a leading infectious disease expert, speaking on One News's The Chiefs last week.
They don't have the mRNA vaccine. Most of our boosted population, now even if we have the Sinovac, but a lot of our population, when we administered the booster, took the mRNA, either the Pfizer and the Moderna. And studies are so detailed about this that when you are given an mRNA vaccine after receiving your Sinovac, your immunity, your neutralizing antibody protects you well against more severe infection, which is not seen in China because most of the population there are given the inactivated vaccine and not the mRNA vaccine.
Experts say the coronavirus is spreading faster than ever in China, and that this is the largest surge the world has seen. But no one has actual numbers because guess what? China stopped publishing case data. But the WHO reckons it's not anything malicious. It's more like Beijing was simply caught on the back foot.
In a fast-moving wave, you might have reported 3 days ago that your hospital is okay. This morning it may not be okay because the wave has come and all of a sudden you have a very high force of infection.
That was WHO Executive Director for the Health Emergencies Program, Dr. Michael Ryan.
So I wouldn't like to say that China are actively not telling us what's going on. I think they're behind the curve in what's actually happening, as everyone is in a situation like this.
Still, other countries have started taking precautions. Australia, France, Italy, Spain, the UK, and the US are now requiring travelers from China to present negative COVID 19 test results before they board the plane. We'll pause here, but when we return, we'll talk about what the country's COVID task force is doing to address this. Here in the Philippines, the IATF is meeting to discuss guidelines on Chinese travelers. At first, the DOH was reluctant to impose additional restrictions, but lately, officials sound more amenable. Here's Transportation Secretary Jaime Bautista.
Pag pumunta tayo sa Hong Kong, kailangan meron tayong RT-PCR and although wala ng quarantine. But siguro we should also adopt similar practices no, for passengers coming from areas where there is high case of COVID. Kasi syempre yung COVID is still there and kailangan protektahan natin yung ating mga kababayan dito sa Pilipinas.
Dr. Ronjane Solante, for one, doesn't think we need to impose additional restrictions on travelers from China for now. Here's why.
Remember, these are all driven by an Omicron variant of concern. Unless there is a new emergence of a variant of concern that is not Omicron, then that's something that the country should be aware of. But if you're talking about BF.7, BA.5, or even BA.2, which I think these are the drivers of infection, why should we strictly close our border when in fact we also have that variant of concern here in the Philippines?
He also says we're better equipped to handle the presence of Omicron variants in the country.
What's the difference between China and the Philippines? The difference here is that our population immunity compared to China is a lot better because we have more boosted population, particularly the vulnerable population. And in fact, you see, the BF.7 has been reported by DOH like 2 to 3 weeks ago, and yet our cases is not that high and expected to increase in terms of hospital utilization. So I think we'll just have to monitor. We have to be careful in looking at this strict border control.
Dr. Solante adds, though, that we should expect a rise in cases this month, but not because of Chinese travelers.
Because of increase in mobility, increase in gatherings now, there will be a slight uptick of the cases. That is expected because factors like there are people or population whose immunity has waned already, especially for those who have been vaccinated 6 months ago. So most likely they can still get the infection. But in terms of rate of hospitalization, I don't think it will really affect significantly. And I would still say that we are still good in terms of rate of hospitalization among those who develop severe COVID.
One more bit of good news. We'll soon have bivalent COVID vaccines. Here's Dr. Nina Gloriani, chairperson of the country's vaccine expert panel, also speaking to One News last week.
The original version is made up of the original strain. So the bivalent, as the name implies, it has two components. So the first one is the Wuhan strain, half of it, and then either B1, Omicron B.1, or Omicron B.45. Yon. So the advantage is that the circulating variant now is Omicron.
And while they have no exact date yet, Dr. Gloriani says we can expect them in the first few months of 2023.
Definitely, there will be prioritization again. So we start with the healthcare workers, so A1, A2, and A3. So basically, the ones who are most vulnerable to getting COVID, especially in the light of these subvariants circulating. The DOH should be able to come up with guidelines soon. Then we know who to give these vaccines to.
And that was today's episode of Teka Teka. Again, I'm Bella Perez Rubio. This episode was produced by Kat Ventura and edited by Mark Casilian. If you like this episode, share it with a friend or two. And don't forget to follow Teka Teka and Puma Podcast wherever you get your podcasts. At para sa mga mahilig manood sa YouTube, Puma Podcast na rin po kami doon. Just search Puma Podcast and subscribe to our channel. Thanks for listening.